Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists dental associates with employment contract and independent contractor agreement issues. Today I'm going to talk about the different types of compensation models for dental associates. What to look for in a new contract, and then some of the kind of red flags associated with each payment model. So first, the easiest compensation would just be a straight base salary, where you get $150,000 a year. They expect you to work a certain number of days per year, and that's it. I would say not very common in the dental industry. Maybe if you work for a DSO, it's probably more common. But if you're going to work for like a dentist-owned practice, that's generally not how the compensation is structured. Next, probably the most common is just a daily rate. So anywhere between $600 to $1,500, based upon your specialty, would be a reasonable amount. And that's very simple. For every day that you work, like a normal shift, you would get paid the daily rate, and that's it. I guess one of the drawbacks of that type of compensation structure is generally you won't get any paid time off, whereas if you have a base salary, you'll always get some kind of paid time off, ideally somewhere between 20 to 30 days of total time off, whereas if you're just paid a daily rate, you're not going to get any paid time off, which can be frustrating for some dentists. And then the last, I guess most common way of structuring compensation for a dentist is net collections. And so the dentist would get a percentage of everything that the practice collects on their behalf. Anywhere between 30 to 40% would be a standard amount. 40 would be high for a dental associate. Usually in the low 30s is what I think would be most common. And so let's just say it's a monthly reconciliation. Whatever the practice receives for the first, or for the last month, they would just multiply that times, in this case, let's just say 30%. And then that's what the dentist would be paid. Now, there are kind of two things that can reduce that amount. One, write-downs, insurance denials. Generally in the dental industry, 5 to 6% is like a normal amount. So for instance, for every $100 that was billed on your behalf, the practice would usually receive $95. And then you also need to be cognizant of lab fees. Some places will charge you for lab fees and others won't. And this varies, like a wide variance between practice to practice. Some places don't charge any lab fees at all, and others will charge 50, 100%. Now, what type of dentistry that you're practicing obviously is going to it will dictate whether that lab fee is a problem or not. Some don't use a ton of labs, and others are almost exclusively use labs. So another good rule of thumb is that can sometimes decrease what you make by usually $2 to $3 per $100 billed. So on average, if you bill $100, $2 to $3 of that would go towards your lab fees. It's another thing to keep in mind. And then I guess probably the biggest red flag that we need to discuss is in a contract, if you are paid purely on collections, you need to be absolutely certain that there's language that says you will receive your percentage, for 90 days after the contract terminates. Many dental contracts that I see state the dentist will receive no compensation after the contract terminates. And if you're being paid purely on collections, and it's a 60 to 90 day cycle from when it's insurance is billed to when it's received, you're essentially working for free for the last month or two if you're not going to get any of those trailing collections. So I would suggest a minimum 90 days, ideally more than that, so that you're going to get paid everything that you actually produced. One last note, this is really specific to dental associates. You don't want to go into any job where you're paid purely on collections from the beginning. You absolutely must have some kind of guaranteed minimum for the first 6 months to a year. It just takes time to build up. And if it also takes time for the practice to actually receive the things that you've done. So let's just say you're pure collections from the beginning, and it takes 60 days for an insurance company to turn around and pay the bill. You could be sitting there for 2 months and not getting paid anything. So you want at least either a minimum daily rate, so as I said before, $750 or something like that, or a minimum base for the first 6 months, and then you would transition into the percentage model. And I would also suggest saying the greater of. So if you are very productive from the outset, you don't want to miss out on any of that money. So you would want to say either the greater of the daily rate of $750 or 33% of what your collections are. And that way you're going to receive what you've actually earned. So that's a little breakdown on compensation models for dental associates. If you have any questions, feel free to contact my firm at the information listed below in the description. And I hope this video was helpful. Thanks.